BOSU stands for both sides utilized. You can work with the BOSU ball either on the half ball side, or you can flip it over and work on the platform. Although for safety purposes, you never want to do any of the standing or stepping type actions on the platform side. So I'll be showing you a few exercises later where you are using the platform, but for now we're just going to use the ball side. A couple other things for the BOSU as far as safety. You want to make sure that you have ample space around. You want to make sure it's inflated sufficiently. If it's too soft, then it's going to be too much of a strain on the ankles and it could cause some problems. Also, depending upon how hard you're working out, and if you do start to perspire, if the BOSU gets wet, it can get slippery, so you might want to have a small towel around just to dry it off periodically. When you're working with the BOSU, there's kind of 4 ways that you can manipulate the exercise to make it either more difficult or easier. The first is contact points. A contact point would be anything that would help you as far as your balance. Contact point could be the floor, so you might be doing some exercises and maybe you're just going to use the floor as an extra contact point. You might be on the BOSU and you could use a body bar. Have the body bar in front here, use that for balance. You could be using a partner, have them work with you on the side. Or you could be using the wall. So if you were up near the wall, then you could just have your hand there for some balance. So altering the contact points or using different contact points can help you with the exercise. The visual effect, changing either your focal point or eliminating any visual stimulus. So if you were on the BOSU, just doing some balance movements where your eyes are closed is going to alter how you're able to balance. Or changing your focal point while you're doing different exercises. Movement, either adding movements or adding larger movements can make the exercise more difficult, or by removing them can make it easier. So you might be on the BOSU doing an action with your legs, and then you might want to add arms to make it a little bit more difficult. Or take the arms away if you're having trouble balancing on the BOSU. And then lastly, adding external stimulus. External stimulus could be a piece of equipment, dumbbells, which we're going to show in a little bit. You could be working with a body bar. You could be working with a medicine ball. Anything where you'd be adding something externally to make the exercise a little bit more difficult.